Yeah, so we started our company approximately a year and a half ago, myself and Michelle Hackenberry, after the physician that we were working with passed away, and we moved the patients off to other treatment centers. These are patients with lysosomal storage diseases, specifically Gaucher, Pompe, Fabry, and MPS-1. And when we did that, to ensure that they could kind of continue their infusion cycles on a reasonable timeline, we realized that about half of the patients were going to sites that were not participating in the Genzyme Sanofi registries. What we do is we look to find patients that are interested in participating in the registry. We often work through the patient advocacy groups to identify these patients through kind of a boots on the ground approach, explain what the registry is to them. If they're interested, we go through the consent process. We're NEIRB approved, and once the patients have been consented, then we've got the ability to reach out to their physician and their prior physicians and compile their medical data into our HIPAA-compliant cloud-based system that we have, and we then de-identify that data and enter it into the Genzyme Sanofi registries currently. Search for the community as a whole. It leads to better understanding, treatment, and management of the disease. So kind of one of our slogans is better research equals better treatment, and hopefully a better life for the patients that are involved. Some specific things that we do for a patient. We provide them an annual report of all the data that's been entered into the registry on their behalf, kind of in January of every year, so that they can look and see what's been entered, make sure that it's accurate, and inform us if it's not, or if there are pieces missing that we can still pull and enter in. Also, we provide an easy and free way for patients to access all of their medical records in one location. So we've done the work of going back and getting the historical medical records for that patient. And we're also kind of currently, maybe quarterly, checking in with their physician and their institution to make sure that we've got the most current data. So we've got it all in one place already, and if that patient wants it for their own general knowledge or their own record, or if they happen to be moving states, going to a new institution or physician, and they want to take that information, they just call us. We can provide them a secure encrypted link where they can get it online, or we can send them a physical copy of the records.